Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be doing an extended review of a medication that we covered in a previous episode known as Venlafaxine. Its brand name is Effexor. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Venlafaxine is classified as an SNRI, or serotonin and norepinephrine reuptake inhibitor. It blocks the reuptake of serotonin and norepinephrine. It does also have some activity to block the reuptake of dopamine. In terms of indications for use, Venlafaxine is indicated to be used in the treatment of MDD, or major depressive disorder. It can also be used to treat generalized anxiety disorder as well as panic disorder. And finally, this medication is indicated to be used in the treatment of social phobia. Now, aside from the labeled indications, there's also some off-label indications where we sometimes see this medication used. So we can see it used in attention deficit hyperactivity disorder, or ADHD. We can see it used to treat depression following a cerebrovascular accident. It's sometimes used in the depressed phase of bipolar disorder. Venlafaxine can be used in menopausal flushing, as well as OCD, or obsessive compulsive disorder. Post-traumatic stress disorder, or PTSD, can sometimes be treated with Venlafaxine. It can be used prophylactically to prevent tension-type headaches. And it can also be used to treat binging associated with an eating disorder. Now, before somebody was to use Venlafaxine, or Effexor, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. This medication cannot be used within 14 days of a monoamine oxidase inhibitor due to an increased risk of serotonin syndrome. If somebody had a hypersensitivity to Venlafaxine or Venlafaxine or any other component of the product, they would also not be able to use this medication. Now, in terms of precautions, this medication is on the Beers criteria, which is a list of medication that the elderly population should either avoid or use cautiously. So we would want to avoid using this medication in the elderly population who have a history of falls or fractures, because the impaired psychomotor function and syncope or fainting that may sometimes occur with this medication may cause additional falls, and falls may lead to fractures. Abrupt withdrawal of this medication may cause serious discontinuation symptoms, so the medication should be tapered off slowly if it is to be discontinued. Uncontrolled hypertension or high blood pressure may be exacerbated by the use of Venlafaxine. And it also may cause an increase in heart rate. So if a patient had conditions that would be worsened by an increase in heart rate, such as heart failure, they should use this medication cautiously. Alcohol should be avoided during the treatment with Venlafaxine. Some patients may notice a decrease in growth rate, especially if they're younger than 12 years of age. Hyponatremia or low sodium has been reported. And a weight reduction of 5% or more has been reported in adult patients. It should be noted that anorexia may occur with the use of this medication. And clinically relevant increases in serum cholesterol has also occurred. When patients use this medication, they may put themselves at an increased risk of experiencing serotonin syndrome, especially if they're using other medications that also affect serotonin. This medication should be used cautiously in patients who have a history of seizures, and patients should be made aware that insomnia and nervousness may occur while using Venlafaxine. Patients with bipolar who use this medication in the depressed phase must be cautious, as it may precipitate mania. And finally, in patients who have renal or kidney impairment, as well as hepatic or liver impairment, they may require lower doses of this medication. Now, there's also a black box warning associated with this medication, so I'm just going to go ahead and read that here for you now. Antidepressants increase the risk of suicidal thoughts and behavior in children, adolescents, and young adults in short-term studies. These studies did not show an increase in the risk of suicidal thoughts or behavior with antidepressant use in patients older than 24 years. There was a reduction in risk with antidepressant use in patients aged 65 or older. In patients of all ages who are started on antidepressant therapy, monitor closely for clinical worsening and emergence of suicidal thoughts and behaviors. Venlafaxine is not approved in pediatric patients. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Venlafaxine or Effexor, there's a couple different dosage forms that they may receive to take their dose. The extended release oral capsule is available as 37.5 milligrams, 75 milligrams, as well as 150 milligrams. The oral tablet ranges from 25 milligrams to 100 milligrams, with a couple different strengths in between. And the extended release oral tablet ranges from 37.5 milligrams to 225 milligrams, again with some other strengths in between. So if an outpatient is using this medication to treat major depressive disorder, they may start off with 75 milligrams per day, given in 2 or 3 divided doses. The dose can be increased by 75 milligrams daily every 4 days to a maximum dose of 225 milligrams daily. If they're using the extended release tablet or capsule, they may start off with 37.5 milligrams or 75 milligrams taken once daily. Again, they can increase their dose by 75 milligrams per day every 4 days to a maximum of 225 milligrams daily. If somebody is using the extended release version to treat diabetic neuropathy, they may use 150 milligrams or 225 milligrams taken once daily. If somebody is using the extended release version to treat panic disorder, they would typically start off with 37.5 milligrams once daily for 7 days. They would then increase the dose to 75 milligrams per day, and with subsequent increases every 7 days to a maximum dose of 225 milligrams daily if needed. For social phobia, if using the extended release tablets or capsule, they would typically use 75 milligrams once daily. And once somebody is stabilized on the medication, there are a couple things they should monitor and let their physician and pharmacist know. They should monitor for a reduction or resolution of signs and symptoms that they're using the medication to treat. During long-term treatment, serum cholesterol levels should be monitored. Renal function may have to be monitored as well, particularly in the elderly population. Patients should also monitor for signs of worsening of depression, including suicidality. They should also monitor for unusual changes in behavior. It's really important to monitor these during the initiation of therapy, as well as when the dose is increased or decreased. And if the medication is to be stopped, they should monitor for signs of discontinuation symptoms, particularly if the medication is stopped abruptly. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using venlafaxine, so I'll go over some of those here now. Hypertension or high blood pressure may happen up to 13% of the time. 6 to 25% of patients may experience sweating. Weight loss can occur anywhere from 3% all the way up to 47% of the time. Constipation can happen up to 15% of the time, and 22% of patients may experience a loss of appetite. Nausea can happen up to 58% of the time, and dry mouth may happen up to 22% of the time. Up to 23% of patients may experience dizziness, and 3 to 7% of patients may experience dream disorders. Headaches can happen between 25 and 38% of the time, and 14 to 24% of patients may experience insomnia. 14 to 26% may experience somnolence, and up to 10% may develop a tremor. Blurred vision may happen up to 6% of the time, and 21% of patients may have a feeling of nervousness. There are also some sexual side effects that may occur as well. Now, some more rare but serious side effects would be hepatitis, hyponatremia or low sodium, the development of a seizure, or worsening of depression, including suicidality or suicidal thoughts. That's all we're going to talk about today with venlafaxine or Effexor. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.